I see most of my ACL injuries in downhill skiing, where you've got people going to Colorado. And because if you think of it, the knee is a hinge joint. It goes forward and it goes back, and that's really what it wants to do. And so it's always these torsion, rotation kind of things. And of course, in a ballistic sport like football, it's going to be tackles and hits and stuff from the side, from an angle, from something like that. So it can be from the foot planting and the rest of the body going forward and moving it, shearing force that way. But typically, it is going to have rotation involved.
Right. So kind of where is the ACL in your body? It
is in the front of the knee. So if when you feel your kneecap, that is actually inside the anterior cruciate ligament. So it's the ligament that goes down the front. So it's actually
like in front, like the shin area there. It's not on the inside of your.
No, it's not on the inside. That's called the MCL. That's the medial collateral ligament. Right. And then, but often there's a thing called the terrible triad. That is 3 injuries, and that's the ACL, the MCL, which is the medial, and then the medial meniscus. So often...
Which is the outside one?
Is the inside.
Inside.
Both of these are on the inside.
Meniscus, okay.
Well, the meniscus is all the way around. It's a horseshoe-shaped piece of cartilage that goes underneath the knee joint. It's within the knee joint.
Okay.
And so... But just the ACL is the big, giant ligament in front. But see, there's ligaments all the way around. There's one in the back called the PCL, which is a posterior cruciate ligament, and then the lateral one on the outside. So you've got the MCL, which is the medial collateral ligament, and the lateral collateral ligament is on the outside.
So complicated. I don't know how you guys make it through school. Oh, my gosh.
Well, then we haven't even started talking about the ones that cross over.
And
stuff. But...
Well, then, after those injuries happened, there were a lot of smart remarks by the fans that said that this was because of the lockout and the guys weren't in
lack
shape.
Of conditioning.
Yeah. Would you agree with that, or what can you do to prevent these kind of things?
Here's the thing. In science, you can't ever predict what doesn't happen. So, if they didn't get injured, you couldn't ever say, well, their chances of injury were this high, and because they did, their chances of injury are this high. Now, it is absolutely true. Preconditioning is the best type of prevention, but because you want to support the entire joint, the ligament attaches a bone to a bone, and then the tendon is the same material but attaches a muscle to a bone. So when we talk about these ligaments, it's attaching bone to bone. So even what we want to do is strengthen the muscles around that joint, but truly, you're making it stronger because just the more pressure you put on it, it responds by getting stronger. However, it's not like when you strengthen a muscle where it changes a whole lot. The ligament is pretty much there, and it's tight. Once it gets stretched, it's going to kind of stay stretched. It doesn't really respond. There's not a lot of blood flow to it or anything, so it doesn't recover as much. That's why when we talk about an injury, it always a tear is going to need a surgical correction and a surgical repair, because it's not going to just automatically heal on its own. Whereas a muscle it has a lot more potential of self-healing. And primarily, it's very uncommon to actually go in and sew up a muscle and do that kind of repair on a muscle. So, because it's just think of when you strap something down on your car or something like that. It's attached here, it's attached there. That's what you got. Okay. And there's 2 kinds of things. There's elastic deformation and plastic deformation. So for some things, when it's a very quick hit, you get this elastic thing. It's kind of like the rubber band where when it snaps back right away, you're okay. Or if you take the shopping bag from the grocery store and you pull it super slow, but as you pull it, it truly changes in its composition. It's not going back. That's a plastic deformation. And so that's what happens you're talking about these guys that have been hit over and over. So they've had injury after injury, but not enough to break it, not enough to tear it. And so they get a bit looser. So the only way to then support that is strengthening muscles around the joint. But still, if you feel a joint, you don't really have a lot of muscle around it. You have a lot of muscle attachment to it, but you don't have a lot of truly supportive things around it. I won't say that it's because of that. I will say that the best prevention is good muscle buildup, strength training, all that kind of thing. But there is no way to prevent 100%.
There's no way to avoid it other than if you can avoid running into the mascot.
Yes.
Now,
yes.
I don't know how.
I'm not sure.
Now, do you practice that with your football players?
You
fans?
know, we may need to do that now.
Yeah,
We've
they take
learned.
that slide. Yeah. Up and over. And all kinds of
Just
everything.
kidding.
Yeah.
I know he tore it before he ran into the mascot.
Yeah.
But
it is. So
I just found it funny that people were blaming it. He ran into the mascot, and the mascot. Like,
yeah.
right.
No, it's anytime, and soccer's another big one.
Yeah.
It's whenever you have cut and change.
Pivots.
Yeah, it cut and change because you've stopped everything in one spot. So that foot has stopped, and now the entire 200 and however many pounds is still trying to move in a different direction. So it's that stop and change, and so that's really because again. You're not stopping necessarily front to back. It's always on the side.
Yeah.
And again, that joint, it's a hinge. It only wants to go forward and back.
Right.
It doesn't like that side change.
Right.
The other big thing is inappropriate muscle structure. So when you've got an overbuilt quad and the hamstrings aren't as strong, so that's another thing. It's not just conditioning, but it's what kind of conditioning. If you've got imbalance in your muscles, so you've got the extensor and the flexor, they have to be equal. They have to support each other because if you overbuild one, it's putting too much pressure again on the front all the time. So you need to have the hamstring in the back built up just as much.
So what does a chiropractor do that can help someone that either has had an injury or
to help for some kind of prevention?
Yeah, prevent. Yeah.
Well, if you've had you've had the hits or you've had the stuff or you've stopped a lot and you've got the knee and it's a hinge and you're up and down. Well, you want it to be in a straight line. Now, if you've got rotation with it, it's not fitting quite right. So now when you're hinging, but it's not in alignment, now you've got extra stress being placed on all the ligaments, all the muscles, and the cartilage that's sitting between the two. So that's really what happens is you want correct biomechanics all the way around. So even though we think of, the chiropractor does this stuff, aligns the back, we really align all the joints.
Right.
And so what we want to do is get that back, and that's going to help take pre-stress off. If you think of, again, we talk about that rubber band, if we've twisted this joint or if we've got it pulled in one way or another, it's like pre-stretching a rubber band. And so now we don't have that flexibility that we had to start with because half of it's gone. So now when you get hit, you don't, you're already that much closer to a true injury, to a true tear. So that's ahead of time. You want to line that up. You want everything working properly. Good biomechanics all the way across the board. And then after an injury, same thing. Now, because we talked about that's a stretch and that's a deformation of that ligament, well, now it's looser. So it has much more of a tendency to go in and out. So right after the injury, now when the swelling goes down and all that kind of stuff, and it depends on the level of injury because there are some that are just a surgical case and we're going to do some nutrition for it because we want things that are going to help that recover. You talk about physical therapy. We talk about the bionutrients that are going to help that heal and make it stronger. So it's a biochemical rehab is just as important as the physical rehab. So that's a big deal.